As record-breaking numbers of migrants flood the southern border, California is offering health care to some living in the state illegally. Today, a historic expansion of California's Medicaid program takes effect, allowing more than 700,000 illegal immigrants to sign up, costing the state over $3 billion a year. Guy Smith, Tracy Walder, and Ian Samuel join me now to discuss. I have to just jump right in there. Tracy, you hear about the idea of migrants being offered, or immigrants who are here legally or illegally, being offered the opportunity for health care. And of course, that gets some people quite worked up.
Well, thank you for having me, Nick, and Happy New Year to you. I just came from California actually 2 days ago. This is where I was born and raised, quite frankly. And when I was at the FBI as an agent there in California, I did a lot with healthcare fraud as well. Look, the Medi-Cal program in California, which is what this would add to, is already very, very strained and is having a lot of difficulty, quite frankly, actually caring for those who are under it right now. When I was in California, born and raised there, the interesting thing that I saw was the amount of unhoused individuals. And so I am wondering now what's going to happen with that as monies are now being allocated towards this. So I understand that healthcare is, a human right and a universal right. But in my opinion, I'm not sure that California, quite frankly, is in the right financial place to be having a program like this.
Ian, ultimately, taxpayers footing the bill.
Yeah, and who pays taxes is people who are living in the state out of immigration status, people who you're referring to as illegal migrants. They have jobs, they pay taxes, they pay payroll taxes. And it's very curious. My friend who loved California so much that she left, I still live here, refers to healthcare as a universal human right and then qualifies that statement with a series of buts. It's not how universal human rights work. The people who are living in this state, people who are paying payroll taxes, deserve to have health insurance and health care just like everybody else. And I'm glad my neighbors will have health insurance regardless of their immigration status. It's why it's still a great state. It's why I still live here.
And Guy, unfortunately or fortunately, illnesses and pathogens don't know whether or not someone is here legally or illegally, that it is in the best interest of everyone to be vaccinated, or what?
Well, of course it is. And of course, the reason that this is a good thing, and it is an incremental expansion of something that already exists, this will keep people healthier, which takes pressure off of the ER in hospitals, which costs the taxpayers even more money. So as Ian said, and it's about undocumented, not necessarily illegal. And there's a big difference. Even the DACAs are undocumented in that sense. So it's not like this governor of Texas putting up barriers. This is something that will make it better for everyone.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.